I'm Cecily Morrison, postdoc researcher at Microsoft Research, Cambridge, and I'm working on the AssessMS project, which you see part of here. So the AssessMS system is a system to support the clinical assessment of multiple sclerosis, with a particular aim of working within clinical trials to create a more consistent measure of disease progression. Now, the guts of it are a machine learning based system, but while many of these machine learning algorithms work well in the lab, we need to find how can we make them work well in real-world contexts where things don't always go to plan. So we've built this prototype to capture standardized data in such a way that will support the machine learning algorithms. Now, in order to do that, we have spent a lot of time observing how clinical practices work and looking at the kinds of things that we need to look out for. So, for example, movement performance can be very different in different clinics. So some doctors will say, stretch out your hand, touch your nose. Other doctors will say, stretch out your hand and touch your nose. While they're all looking for the same thing, they're looking for this tremor that we see when we come close to the nose. We've got two very different movements from a computer vision point of view, even though to the doctor they see exactly the same thing. We also have issues around the exact positioning of the patient. So the computer vision algorithm wants to compare one patient with another, and in order to do so, they need to be as similarly positioned as possible. Of course, there are techniques that we can use to normalize the patient, move them around. But the more we have to do it, the more likely we are to lose hands out frames, lose heads off tops, and such. So we've created a number of tools for the health professional to manage this kind of different positioning, so they can position the patient just so. We've also looked at the kind of distractions that you might find within an environment. So the Kinect camera gets distracted by things that are shiny. You get big black spots within the images instead of the patient that we would like to see. So things like shiny wheelchairs, metal chairs, kind of things that you would find quite commonly in clinical settings are not things that we want to be in the Kinect view. We also don't want a clinician walking in front of the view and putting his hand on a patient. So these are all the kinds of things that we need to attend to when we're designing a system to make sure it's going to work within the real setting. So here we have an instructional system, so we get movements performed in exactly the same way. They tell the patient what to do. Drawing squares. Please draw two imaginary squares with your hands in the air. Begin by raising your hands in front of you to eye level. Draw down to your chest, out to your shoulders, up to eye level, and in. With that, we can begin a test, and we can do drawing squares both sides, eyes open, and we can go on to the various variations that we need to do. All the while, the health professional is monitoring what is the camera seeing and monitoring exactly how the movement should be done. Fortunately, this seems to have worked quite well. We have, in some regard, attended to all the things that we need to attend in a clinical setting. So we've just got results from a study where we tried this with 50 patients, 12 health professionals who never used the system before, and found that we got 98% of movements performed correctly. So we found that positioning was statistically significantly better than with the previous system. And we've also found that we had less instances of distracting objects which can ruin the videos for processing. So we're quite pleased with our results, and we're looking forward to taking this to the next steps.